I first met Mike Fanning through Synergetics, and Synergetics was absolutely an amazing company. When we were starting out looking at surgery centers, one of the things that we found that was really an issue was that starting surgery de novo in a surgery center was just going to be cost prohibitive. That wasn't until Synergetics I first met Mike Fanning. They changed the paradigm. It used to be that starting retina in a surgery center would be $200,000, $300,000, $400,000. And with the VersaVit platform, we were now able to start surgeries in a surgery center for under $100,000. This opened so many doors for us. Doors in Eastern Kentucky, doors here in Lexington, doors in Louisville, doors all over to create these opportunities for us to operate in more efficient environments, environments that were embraced by our referring doctors, and environments, frankly, that benefited our patients because they wouldn't have to travel quite as far. All of this was because Synergetics thought outside the box. And that outside the box thinking was really because of Mike Fanning. What I've seen with Vortex is absolutely amazing. In such a short period of time, they've been able to do so much with such a lean team. Their rapid prototyping is absolutely unbelievable. They have engineering that listens, that develops prototypes rapidly, that wants your input as a surgeon as to things that can be done better. I'm impressed not just with the speed of which they're able to produce prototypes, but the quality. The best example is the Actuate forceps. Now, I was skeptical, and I'll tell you that the two most important things as a retina surgeon are visualization and the forceps you use. When you're peeling on the surface of the macula, you really don't want to take any exceptions when it comes to quality and performance. Now, we went through quite a bit trying to design the Pinnacle forceps, and it was really tough. It was tough to hit the mark on how the actuation of the forceps, the ends of the forcep, the grip of the forcep. And that made me, frankly, really skeptical about the Actuate forceps. I know just how hard it is to design forceps because I worked with Synergetics on trying to design the Pinnacle. And frankly, it was frustrating. But when I got the first pair of the Actuate in my hands and I saw how they performed, I was blown away. I was blown away that a startup company, could hit the mark with forceps in such an amazing way. By my second case, I actually felt like I would prefer these forceps over what I was using as my standard, which is the gold standard for forceps. And so when factoring that along with the cost considerations and the cost savings that these forceps offer, and then finally the people behind Vortex, it really made a no-brainer for me and for our surgery center. I've been incredibly impressed with Jim Easley. Jim's somebody that I worked with a little bit in my time working with Synergetics, and I was impressed by Jim, but they've really taken the reins off of Jim when it comes to designing products. I think they tasked Jim at Synergetics with certain projects, maybe projects he had interest in or whatnot, but at Vortex, it's such a small team that Jim actually is able to aggressively pursue and follow some of these different projects. And if the results of the Actuate forcep are any indication, they're off to a good start. I think retina needs a surgically focused, surgery-only company. Frankly speaking, we miss Synergetics. There's very few companies out there that aren't owned by pharmaceutical companies. So to have a company that is focused on surgical instrumentation of the highest quality, a company that's focused on partnering with retina, and a company that has the leadership that has demonstrated time and time again that they would stand behind and beside vitreoretinal surgeons, that they would partner with vitreoretinal surgeons to allow them to succeed in all areas, is frankly something that I think we can't afford not to get behind.